Everybody's now aware of Ozempic, Wegovy and Mounjaro. These are fat loss injections which were originally designed to change somebody's metabolism, and somebody who had diabetes was prescribed these drugs. What we found was that there was an associated weight loss with these drugs, and this helped to reset the metabolism. Now they've become popular in today's world as weight loss injections, and what I'd like to talk about today is what are they, how do they work, and what you should expect from them. Hello, I'm Dr. Aamer Khan from the Harley Street Skin Clinic and the Harley Street Longevity Clinic. Now, my background has been 40 years in medicine. The first 20 years of this was spent in the National Health Service, where I trained to be a general practitioner looking after people's general health. My speciality, if you like, is integrative medicine, putting the patient at the center of our care program and looking after the patient as a whole. As part of my evolution and my progress through my career, I started my career in aesthetics and cosmetic medicine about 20 years ago. And during that time, I've also looked after my patients from a medical perspective as well. Again, putting them at the center of our care program. People want to look good, but it's not just looking good that's important for them. It's also feeling good. So looking good on the outside and feeling good on the inside gives so many benefits to our physical and psychological health. So as part of that, when the semaglutide drugs were starting to be used for weight control, I studied them for a whole year before looking at them and starting to use them myself. And what I found was that research was coming out to show that they actually had a real benefit, but there were side effects and risks as well. People who have thyroid cancer should not take this. It doesn't cause thyroid cancer, but it can accelerate the process. So it's really important to have a proper medical assessment beforehand. Well, what are they? They are a hormone analog, and they are a GLP-1 analog. In other words, they work like GLP-1, and Mounjaro also has GIP. So these act like glucagon, which changes your balance of insulin production, insulin sensitivity, and sugar metabolism. So what do? They have much more effects than that. So what they do is they have a number of metabolic and physiological and mental effects. There have been 42 benefits which have been discovered through taking these medications, but they also have side effects. So you must take them under the supervision of a doctor who knows what they're doing with you. And you must be supervised, and you must see that doctor on a regular basis. We have a program where we have doctors who are trained specifically, and the way that we provide this service is through a consultation initially to establish whether or not you are suitable for this medication. The second step is to do some blood tests to establish your physiology and whether there are any problems that you may have that need attention in different ways, such as an underactive thyroid, other metabolic problems which these don't necessarily affect. Blood tests also give us a baseline because most metabolic disorders are associated with lipid problems. So high cholesterol, high low density lipoprotein, which is a bad lipoprotein, and that can increase your risk of heart disease and of strokes and dementia. The other things that can happen with metabolic disturbance as we put on weight is that we can develop high blood pressure. So all of these things need to be monitored and measured if we're going to go on to these medications. And what we'll find is that we will have a benefit, an improvement in these conditions. So these are what we call biomarkers. There are physical and biochemical biomarkers which we monitor as we go along to see that we are actually affecting a benefit. What do these drugs do? Well, the first thing that you may notice is that your appetite reduces, that you can't eat as much, that your noise for food starts to diminish. Certainly particular types of food like carbohydrates, sugars, things like that. Also your appetite and your noise for alcohol will reduce as well. So what's happening is that they're changing your brain's communication with your nutritional needs. And now your brain can listen to what it needs rather than just sugar, sugar, sugar all the time. They also have a physiological effect in that they increase insulin sensitivity, and they also increase the production of insulin from the pancreas. And this is why people with pancreatic problems like pancreatitis or pancreatic cancer may get an overstimulation, and those conditions may be made worse through taking these medications. So it's really important to know and have somebody who knows how to look after you monitoring these things. What else do? They slow down the gastric emptying and the transit of food through your guts. Your stomach shrinks and your satiatory sensation increases. In other words, you feel fuller sooner and you suddenly stop eating. A lot of people notice that when this kicks in, they'll think, oh, it's time for dinner. They'll go to the fridge or go to get something to eat and they think, oh, I don't really fancy it. Or normally if you would have a whole sandwich, you might only have half a sandwich and you've had enough. And that's great because you're not giving up anything. All that's happening is you're enjoying it, but in smaller quantities. This all contributes to a reduction in the calorific intake. However, there is a danger that you're taking less nutrients as well. Micronutrients and macronutrients, which are essential for maintaining a healthy body. We recommend that you go on to a balanced, healthy diet. And part of the program is to go through that with you. And I'll go through what happens when it happens and how we advise as we go along. The first part of the program is to get the dosing right. So we always start off with microdosing so your body can get used to the medication and you can start getting used to the changes that are occurring in your body. So for the first month, we put you on the lowest dose. Now, some people don't notice very much. Other people notice that their appetite goes down. One of the problems you may experience is that you may get indigestion and the feeling of fullness and sickness if you eat too much. If you're getting this, that's fine. It's to be expected. However, it will settle down over a period of time. If the symptoms are severe, then we recommend you take some omeprazole or esomeprazole, Nexium, which you can get over the counter to help with the symptoms of indigestion. The other thing you might notice is because you're eating less, you may get some constipation. Now that's easily remediable by drinking plenty of fluids and taking extra fiber in your diet. So by being aware of what's happening, you can adjust your diet to compensate for it. Another thing that might happen is you might get a little bit of loose motions. Now this can be a side effect of the medication, and again, it's transient and it's temporary. It can, in some people, last up to 6 weeks. And if it's severe, that can cause electrolyte upset. So if you're getting this, again, it's important to be under the care of a medical professional who can look after you and advise you accordingly. Other reasons for diarrhea might be that you're eating too many sweet things and sugars, and you're getting what we call the dumping syndrome, where the sugars transit to your gut, pull a lot of fluid into the gut, and cause diarrhea through an osmotic effect, which is pulling water into the gut and causing loose motions. So those are the things that are the common side effects. In the first week, you're going to notice that you might fancy food less. You may not notice very much at all. In the first month, you may not notice very much at all. But a lot of people do notice that their appetite goes down, that the noise for food starts to diminish and may even disappear. They're drinking less, and some smokers find that they're not as drawn to cigarettes as much because it also has an effect on our addictive centers in the brain. Our sleep will improve, we'll feel more energetic, but we're on a small dose, so these effects may be small. Some people may even notice a weight loss in that first week, but on average, we start to see this kick in after a month to 6 weeks, and people start to lose weight. If everything goes well in the first month, in the second month, we normally would prescribe the next dose up. Now, the first 3 months to 6 months is what we call dose stabilization. In other words, what we're doing is we're adjusting the dose so we get minimum side effects and we get the maximum and the best results possible. Now, as we lose weight, there is another side effect that we need to be aware of. We're not just losing fat, we're losing weight. We're eating less, our intake of protein is less, so we're going to mobilize proteins from elsewhere. And the easiest place to mobilize that from is from our muscles. So people can see a reduction in their muscle mass. And that's why it's important to be seen, to be measured, to have your body fat, body muscle, and body water content evaluated. That can be done by some electronic scales or by an electronic device that your doctor will have, And what we can do is we can monitor those as physical biomarkers as to how you're doing. We also give advice after the first month on diet, because we're eating less. It's important to eat a balanced diet. So we talk about diet. Month 3, we talk about nutrition, because what's in your diet is important. Remember, I said that you're eating less and you're taking less nutrients through your diet. So eating a nutrient-rich diet is really important. We also check some of your vitamin levels when we do the blood tests, and we may recommend some supplementations. The following month we talk about exercise, because by this time you're losing weight, and on average for every 7 kilograms or 7 pounds that we lose, we will lose 1 kilogram or 1 pound of muscle mass, lean mass. Now bone mass takes much longer to go. It's the muscles that change very quickly. So month 4 to 5, we recommend particular types of resistance exercises using weights or bands, which keep the muscles in great shape. And don't forget, we're monitoring your muscle percentage as you're losing weight. And if your muscle percentage stays constant, it means you're losing muscle as well, because that's part of weight loss. But if your muscle percentage goes up, then you're not losing muscle mass. And it's really important to maintain at least the same percentage or slightly increase it, so you're losing relatively more fat. The places the fat comes off from is also interesting. Now, normally when we exercise, the last place it goes from is around the stomach, around your back, around your hips. With this, that's the first place it goes from, because it's targeting visceral fat, and that's fat around your organs, and that's a dangerous fat. We also monitor the visceral fat levels, and we can see it coming down. After that first stage of dose stabilization, we move into a phase that we call habitualization, and that looking to set new habits, new choices, and get used to those. And that's done through education. It's done through you doing the right things and making the right choices. And if you do that for long enough, then they become your normal habits. And that's what we guide you through over the next 3 to 6 months. The program can last anything from 6 months up to 18 months. The final stage is what we call withdrawal of the program. Now that's done steadily and slowly. And what we monitor is, as we reduce the dose, once we've achieved your targets, as we reduce the dosage, we monitor to see how your body composition responds to that, how your food noises and how you're eating and your habits respond to that. And we may find that we can come straight off and end up by taking no medication at all, and everything stays stabilized for a period of time. In some people, we find that microdosing is important to maintain that healthy body proportion and physiology. I've seen patients where their blood pressure has come back into the normal range. I've seen patients who have been waiting for coronary artery bypass, and their physiology has improved so much that the narrowing starts to disappear and their health improves. People have been able to come off diabetic medication, hypertension medication, heart medication. All of these are due to the benefits of these medications. However, if they're not taken properly, if we overdose on them, we can see the severe side effects. In that, if we're losing too much muscle mass, we can see that in how we look. Our faces drop, the quality of our skin diminishes, because protein is really important for collagen production. And what we see is that people start to look older, they become weaker, they lose muscle mass, and they can also lose mass from their cardiac muscle, which can shorten their lives. So it's really important to be monitored and to do things properly. So what's all the excitement about fat loss injections with semaglutide and with Mounjaro? The excitement is that they actually work, to the degree that companies like Weight Watchers have gone out of business. However, there are side effects: indigestion, constipation, loss of muscle mass, and malnutrition. So it's important to have these drugs under a safe guidance by a practitioner who knows what they're doing. So if you'd like to find out more about how you can safely lose weight and enjoy the other 40 plus benefits that these medications give you, then contact the Harley Street Skin Clinic at the website shown.